talk about the nervous system. Welcome everybody. We've all heard that, well, you have a lot of nerve. Okay, but that's a different kind of nerve than this nerve. These nerves are tactile. These nerves actually do a lot of work in the human body besides providing that tactile sensation. And so it's really interesting to me how the nervous system is responsible for so much good, hopefully good, function in the human body. And we're going to talk about that. There are two parts to the nervous system. The central nervous system, which is the brain, and of course going down into the spinal cord. Okay, and then the spinal cord ends in the cauda equina, which then goes down into your lower extremities. And then once we cover this, we will talk about the peripheral nervous system, which helps your arms and legs function. All right, so the brain is, of course, this is Operation Central. Okay, the brain, of course, is controlling everything about your body. And as we have talked about, the interaction between the various body systems is very consequential with regard to proper function or dysfunction. Okay, so the words that you need to understand are the brain is separated out into lobes, and you can see our beautiful illustration. I'm pretty sure that most of us do not have purple and brown and in lavender in our brains. Okay, this is done for illustrative purposes, and if the occipital lobe of your brain is green, you really need to see a physician very quickly. Okay, but the point is that each section of the brain has responsibility for a different body function and successful interaction between body systems throughout. Okay, now some people use the word brain and the word cerebellum interchangeably, but that's not true. The cerebellum is only one part of the brain. And remember that there are a large number of things, and this fascinates me, okay? There are a large number of things, signs and symptoms that will show up in other body systems, in other parts of the body, that actually indicate something is going on up here, or not, as the case may be. Okay, I'll give you an example. I work with a patient who had normal pressure hydrocephalus. And the way that normal pressure hydrocephalus exhibits itself is urinary difficulties and a robot-like walk. It almost like the patient's feet are like stuck to the ground and they have to halted like that. Isn't that amazing? Okay, so we know by the way someone goes to the bathroom and the way they walk, their gait, that there's something amiss up here. It's fascinating. Okay, so let's talk about the specific areas of the brain. Now, again, these are terms that do not you do not necessarily need to memorize them. You know how I feel about memorization. But you need to have a sense of familiarity, okay? Also, I want to point out that the brain is identified as various lobes. But remember when we talked about the respiratory system, you have lobes of your lungs, you have lobes in your brain, okay? And all that is a designation of an area, of a section, kind of like a neighborhood, okay? All right, so your frontal lobes, these are right here, right behind your forehead. And these are responsible or participatory in voluntary muscle movements. What that means is your brain says, I want to move my arm, and then you move your arm. That's a voluntary muscle movement, as opposed to the autonomic nervous system, which you see in the second part of this section. That's involuntary, which is a good thing, because your autonomic nervous system is responsible for the cardiac activities. So remember, when we talked about the heart, the nervous system, the nerves that are within the walls of the heart are what tell the muscles of the heart to squeeze, to move the blood through your body, okay? And we talked about this, so now you can imagine if you had to sit there and voluntarily move your heart muscle to pump blood, you would not be able to do anything else, okay? Also, particularly for the men out there, I want to point out that emotion is a function of the frontal lobe, and you'll notice it is an involuntary response of the autonomic nervous system. That's a gender joke. I'm sorry. You know how they always say women are too emotional. Well, we just have larger frontal lobes, which give us motor areas for speech, Broca's area, which enables us to properly explain what we want to do or have done. Personality, well, you know, behavior, and intellect. Critical thinking, memory, judgment, you know, all those things that we're trying to stimulate here in the university in you, okay? So that's what we're aiming for right here, not like an NCIS when Mark Harmon used to smack him in the back of the head. That's the wrong lobe. He needed to smack him in the front of the head, because that's where we get judgment, memory, critical thinking. Okay, so just remember that. All right, the fissure of Rolando. They did not invite me to the meeting to name this. I don't know where it comes from, but this is a sulcus, and a sulcus is like a little trench. It's just a section that separates out the lobes. I mean, just as we see them in different colors, but they are actually separated out by these sulcuses. Okay. The parietal lobes. Where are the parietal lobes? Right here. Yes. On the opposite side, the right parietal lobe processes sensory data from the left side. I don't know if you've ever seen that meme that says, because the parietal, well, it doesn't say parietal lobe, but it says the brain processes information from the opposite side of the body. So therefore, people who are left-handed are the only ones in their right mind. Get it? Okay, that's a little, I didn't make that up. I'm just sharing it, but it is kind of funny. But it also can help you remember the parietal lobe. Yes, the opposite sides. So my right parietal lobe is going to, I'm sorry, the dog is sitting here and I got scared. Is going to feel that impact. Okay. Next, we have the fissure of Sylvius. This is a lateral sulcus. It's the line between the temporal lobe and the frontal and the parietal lobe. So it's like a T stop sign. Okay. Then your temporal lobes. And what do we call this part? What do we call this part of your glasses? Right? They're called, oh, wait. Now the word went out of my head. Okay, I shouldn't have hit myself in the front of my head the way I did. But okay, these are your temples, right? Isn't this where your temples are? So this is where your temporal lobe, that's where we get the name, okay? Temporal lobes, senses, smell. So your temporal lobes help your nose work, your taste buds work, and of course your hearing, as well as your interpretation of spoken language, which makes a lot of sense because that's where it's entering. Your spoken language is you're hearing it and, oh, that's what she says. That's what she meant. That's what he thought. Okay, the parieto-occipital fissure lies between the occipital lobe and the two parietal lobes, right? So we talked about the occipital lobe in your illustration that's green, not moldy green. It's kind of like a nice sage green. Okay. And then your occipital lobe, which processes visual impulses. So you actually see from the back of your head. So when your kids say, what do you have eyes in the back of your head? You could say, not eyes, but visual interpretation. Yes. You see what an education can do to your relationship with children? It's amazing. All right. Now we're going to connect right here at C1, also known as the atlas. And the brain is going to connect to the spinal cord, which you will remember when we talked about the skeleton, that the vertebrae have that hole in the center, and that's exactly where the spinal cord lives. It is part of the central nervous system, located along the dorsal, okay, the posterior surface of the torso. So it's right here, okay? And remember, from Shark Week, the dorsal fin of the sharks, that's what you see poking out of the water, and you go, oh, all right. I live in Florida, so, shark attacks and shark bites are, I don't want to say common, but they're certainly not unusual. All right, so starting at the brainstem, the foramen magnum, the spinal cord is threaded through the center of the spinal vertebrae, right through that hole, and ends at L1 or L2, which is right at your waist. What? Okay. And that's then where the cauda equina is. And it's called the cauda equina because cauda is actually tail, Latin for tail. And equina, you know what the word equine refers to? Horses, right? Because the nerves coming off at that point at L1 and L2 look like a horse's tail. Not a horse's ass, a horse's tail. Okay. And this is protected by the vertebral body. And then that's how the nerves, the peripheral part of the peripheral nervous system goes down into the legs. And that's why you can feel things with your toes. Okay. All right. Okay. Your spinal nerves, again, remember that all of these nerves coming off of the spinal cord that give you your sense of touch, and more importantly, as we've been talking, give you that ability to do this. right? Is because remember, the brain is telling the nerves tell the muscles, and the muscles move the bones. Wow, this is really some engineering project. Okay, all right. So again, this is not necessarily something that you have to memorize. But again, you want to be familiar with C1 to C8. Now, this is a part where, had I been in the meeting, I would have raised my hand and said, no, because C1 is also a reference to the first vertebra, right? C2, C3, C4, C5. T1 through T12. That's how we also relate to the vertebra. So you have the same exact abbreviation or designation for the nerves that you do for the vertebra. Now, okay, they had a little bit of good reason for this, and that is wrapped around the fact that these nerves are coming off of the spinal cord, branching out from the spinal cord from each of the vertebra. So the vertebra, C1, C2, C3, are the point of origination for those nerves. Does that make sense? Give me a uh-huh or uh-uh. Uh-huh. No, it doesn't make sense. Okay. The spinal cord comes down. Now the spinal cord is like a bunch, it's like one of those cable conduits, okay? It has its housing, but within it are all of these individual nerves. And then these nerves branch out as we go down the spinal cord. They branch out at the plexuses, to take care of the rest of the body, the arms around the front, the thoracic spinal nerves become intercostal nerves. Remember, intercostal refers to the ribs, in between the ribs. Is it making sense? Yes. Okay. All right. Excuse me. All right. So the lumbar nerve, then we have the thoracic nerves, the lumbar nerves. And again, you know this already because they directly relate to the same terms as the vertebra in the spinal column. And that's because that's where these nerves are branching off from. Okay? Good? All right. All right, now let's talk about the peripheral system because we're kind of there already. And these also connect up to your brain, okay? Remember, we talked about the occipital lobe of the brain processes visual impulses, right? So there's got to be a connection between the nerves in the eyes and the occipital lobe. Okay. Now, in most cases, references to the individual nerves, the 12 cranial nerves. Now, the cranial nerves are part of the peripheral system. Why? Because take a look, the olfactory nerve fibers, so you can smell. Hot apple pie, fresh out of the oven. Oh, man. Okay, Thanksgiving is coming, my favorite holiday in the entire world, because all it is about cooking and eating. Okay, and what would the joy of eating be without your olfactory nerves? Right? How much do you taste? when you can't smell because you have a cold or allergies. You see? Okay. The optic nerve coming from your eye. And let's see, the facial nerve. And if you know somebody who has Bell's palsy, for example, Bell's palsy is affecting your facial nerve, which is your 7th cranial nerve. Again, you are not going to perform surgery on patients. So it's not necessary that you know this in detail at this point of your career. It's going to depend on where you go from here. All right. But again, you need to have a sense and a familiarity with that. Okay. Make sense? Thank you. So what am I going to tell you? Review often, because that's how you get it to stick in your brain. Use your medical dictionary so what you're sticking in your brain is accurate and not what you kind of thought of, maybe remembered. And query when necessary, because you got to ask me when you don't understand something so I can explain it to you in a different way so then you can understand it. That's how this whole academic education thing works. Okay? Okay? All right. And when you want to query me, or when you want to say, I'm not so sure, this is my email address. Remember, I know I've told you, but I want to keep reminding you, the email address in the course under class list is wrong. I will never receive that. So please use this email address, or you can post something in the discussion forum and the questions, and we can arrange. I can then email you and we'll get together. Okay. But I'm in here every day, 7 days a week, rain or shine. So I'm here for you. Please do not get frustrated. Ask me to help you, and then you won't be frustrated. Okay. It works better that way. All right. Any questions? Do I want to say, have a wonderful day, have a wonderful week. Don't forget to vote. I voted yesterday, early voting. You know what? It took me an entire 10 minutes parking in and getting out. So please have your voice heard, okay? And I will see you next week. Bye-bye.